pregnant trauma. Do you want me to describe that?
Dr. Michael and Nurse Lucy Stranger are heading up a team getting ready to receive a young pregnant woman injured in a car crash.
This is a pregnant trauma with vaginal bleeding, which is never a good thing. Try and prepare for the worst.
The accident happened more than an hour ago, so they must quickly assess both the 23-year-old and her unborn baby.
Kayla's currently 27 weeks gestation, first pregnancy. She's been struck by a four-wheel drive that was going past with a large bull bar. Probably compressed about half of the engine bay on the driver's side, spun the vehicle about 90 degrees. She says that she struck her head on the windscreen. About 20 minutes before she got in the car was the last time she felt any fetal movement.
Kayla was leaving her local supermarket when the other car smashed into her. Partner Joe's now on his way to be with Kayla, who's 6 months pregnant with the miracle baby doctors said she'd never have after battling cancer.
Past history of osteosarcoma. She's been free of cancer for the last 3.5 years.
Osteosarcoma is a type of bone cancer that we sometimes see in the long bones, like in the legs and the arms. And in Kayla's situation, she's had 2 osteosarcomas removed, one on her right leg and then a few in her ribs as well on the left-hand side. As a result, she's had some prosthetics put in, a metallic prosthetic in her right leg and also some concrete prosthetics in her left ribs.
Kayla, I'm Luce. I'm one of the nurses. How you going? You've had better days. Yeah.
I've personally never seen anything like this before, so it's quite a unique circumstance that we're dealing with. So for Kayla, we'd assess her like any other patient, checking head to toe to make sure that she's breathing okay, the lungs are okay, and also looking for any signs of significant bleeding.
Sorry, dear, have a look at the tummy now, okay?
She's got generalized lower abdo tenderness.
One of the concerns we have is that there may be some fetal distress, and that's what we use to describe a baby who's struggling. The placenta can tear away from the uterine wall, and that can lead to significant bleeding, which puts both the mum and the baby in danger.
Over in Trauma 2, Dr. Michael Dunn is performing an ultrasound on car crash victim Kayla to see if her baby is in danger.
The abdominal fast is okay. I'm just checking the pericardial views. Good to feel a heartbeat as well.
The first-time mum-to-be hasn't felt the baby move since before the accident.
Did you say you know the sex?
Yeah, a boy.
Yeah. Oh.
When we do the ultrasound and see, is there a fetal heartbeat? Is it fast? Is it slow? But it's very scary checking to see that, and particularly if you can't find the heartbeat, something that's very difficult for Kayla and very difficult for the staff as well, not knowing if we'll find a heartbeat or not.
Kayla's waiting for a sign that the baby doctors said she'd never have because of cancer treatment at 19 is safe.
There's no obvious bleeding anywhere.
Good.
So, did you hear that? There's no obvious bleeding down there at the minute, which is really good. And the heartbeat looked nice and strong. We're going to get some x-rays. And then we're going to probably go get some scans just to make sure that everything in you is good. Okay, beautiful?
Yeah.
Now,
Anyone found Joe?
he'll be in the waiting room. So I'll bring him up as soon as all of this faffing about is over, because there's too many people.
Kayla will have to wait to be reunited with her partner Joe.
Put your arm by your side for me.
She's not out of danger yet. X-rays and scans are needed urgently to check Kayla's leg and artificial concrete ribs for fractures.
Can you shut your eyes? Okay.
Nurse Lucy goes to find Joe, who's arrived at the hospital, still in shock over his partner's accident.
Hey, mate. What's your name?
I'm Joe.
Hey, Joe, I'm Luce. I'm one of the nurses. I'm looking after Kayla.
Oh, yeah.
Yeah? How you going, matey? All good?
fine, yeah.
Yeah. Okay. Do you want to go up? Do you want to go up? Yeah, let's go. Family is very important to someone who is unwell. If you've ever felt any form of fear, you instinctively want someone close to you. Look who I've got. You're right, darling. Really? Yeah, we'll give you some more medication.
Though Kayla's been cleared of any internal bleeding or harm to her baby, the CT scans reveal another problem.
The CT scan did show that she had some fracture or a break to her prosthetic cement ribs. So we'd have to speak with the cardiothoracic surgeons and get their opinion as to whether there's something that needs to be operated on. It'd be quite an extensive operation and may actually lead to complications for both Kayla and the baby. Given Kayla's history, I say she probably thought her scariest moments in hospital were behind her, and having to go through this again when she's pregnant must have been quite an ordeal for her.
Kayla will have to spend the night in hospital while she waits for the surgeon's decision.
I poked my head in here before and you were asleep, and then I poked my head in a little bit later, and there's Joe eating breakfast off your stomach, and I was like, Joe?
Nurse Lucy's patient, Kayla, was at risk of losing her 27-week-old baby after being in a car accident. Yesterday, Dr. Michael cleared the unborn baby of any harm. But X-rays revealed Kayla's concrete prosthetic ribs, which were the result of her bone cancer, had been fractured in the car crash.
How's your ribs?
Yeah, it's better.
Yeah? No.
It's still tender, but it's not.
It's been an anxious night for the young couple, waiting to hear if Kayla will need surgery to repair her ribs.
Fortunately, in Kayla's situation, the cardiothoracic surgeons assessed her and they felt that the actual plate itself had maintained its structure and wasn't actually at risk of causing any long-term problems. So fortunately, it didn't have to be replaced or repaired.
It's a bit of a special bub then, by the sounds of it.
After Kayla's battle with cancer and surviving a car crash, the couple are looking forward to the birth of their first child.
See you, beautiful. See you, Joe. All good, babe.
For Kayla and her partner, Joe, being so young and starting a young family must be quite an ordeal. We see patients at a point in their lives where they're most scared and most afraid, and we have the knowledge and ability to reassure them and put them on the right path, and I think that's a very rewarding aspect of the job.
3 months down the track, Kayla is now a mum to baby Noah.